Hi, I'm Howard Goldman from Cleveland, Ohio. So the question was raised, how do we deal with patients with refractory overactive bladder? So I think it's important for us to define what refractory overactive bladder is. So again, overactive bladder, those are the symptoms of urinary urgency, frequency, urge incontinence, things of that nature. I think all of those patients initially should be treated with behavioral therapy, pelvic floor therapy, medication. Perhaps not all those, but one or the other. I think if a patient has tried pelvic floor therapy and has tried at least 2 medications and either is not getting the response they want or cannot tolerate the side effects, those are the patients who I call refractory. And the patients that I manage who have refractory overactive bladder, typically the next treatments are either some sort of neuromodulation or occasionally botulinum toxin or Botox. Now, the types of neuromodulation that are out there are percutaneous tibial nerve stimulation, which is really an office-based therapy, which requires the patient to come in about once a week for 30 minutes, and we stimulate the tibial nerve. Given that that's an office-based therapy, we are sometimes even now using that as primary treatment. The one that has been in our mainstay for quite a while is sacral nerve modulation, the interstim. And now we do where we actually place the lead near the sacral nerves, give it a trial, and if the patients have significant improvement in symptoms, actually implant the entire system. And that can be very successful in some difficult patients. Alternatively, we sometimes use Botox. Now, Botox is approved for patients with neurogenic etiology of overactive bladder symptoms, but we sometimes do use it off-label for idiopathic, and I expect with the time that will become probably approved and part of our natural standard of care. So again, usually it's some sort of neuromodulation or Botox. Now, if someone fails all those things, that's when we start talking about a bladder augmentation or some experimental therapy, and those are certainly should be handled by people who are really used to doing those sorts of procedures.